3P event is getting clinicians and providers together to look at the work that we've done so far on designing and planning for the design for the new facility, to look at workflows to make sure that what we're preliminarily thinking makes sense from a workflow standpoint.
They have much fewer pieces over there.
Yeah, much fewer pieces.
You're thinking it's kind of an open concept coming through it. Is that what I hear?
Okay.
Okay.
You've got a strong idea going. Why don't you guys really work on finishing this one, and then you can test some other different ideas?
So we have a crash cart, crash cart, crash cart.
What if we flipped one of the critical care units over here and stacked these two?
I think if we're going to stack them, we won't flip. And we're not actually truly not as focused on exactly how we get every room to line up, but we really want to get the ideas behind what you're trying to achieve, how you want to deliver care in the future, how you want to work with each other in the future. One of the things that we're doing today with one of the groups is that we're breaking down the traditional departmental barrier and getting everybody just to work together for the best patient care experience and for the best staff and provider experience. So if we could get that accomplished, and I think we've hit a home run.
Well, if we put it here, here, and here, that would make this concept great.
Maybe we put it towards here if it's something that can be shared with both sides.
We need to have an efficient model of care. Consumers are going to have a bigger say in how they receive their health care. So we're actually very fortunate here in Bloomington because we get to embrace all of that in a new model of care.
If your family member was down there and your waiting room was here, would that be?
Well, we don't want them to be walking all the way through the unit.
Long corridors that you can see front to back. Try and do it like that. And
so
just
do all the
see
procedurals back here.
All the rooms back here, you can make it so that the cath lab is right here.
I think we have to keep focusing on our outcomes. What are we hoping to achieve? And I think the other part of it is we really have to focus on making healthcare seamless, that it really is evolving across the continuum, that it's not just about acute care or ambulatory care, it's about how the patient navigates healthcare.
Yeah, no, that'd be okay, because if you had another x-ray room, like the reading room here.
We're going to keep the ortho trauma patients, which can be rough, away from the elective joint patients, which are back here.
After you've evaluated, you talk to David and say, look, these three are the same thing. Let's just put those all together.
The engagement has been better than I had hoped that it would be. The leadership by the physicians in the groups has been better than I thought it would be. To see them lead some of the exercises and lead the report outs has been very gratifying to me. Sort of like everybody left their rank and serial number at the door and everybody's just participating to build a better healthcare system. It's pretty cool.
But this is nice because, again, someone from critical care that needs to have surgery, they come right down back entrance into the pre-op station, into their OR room, trauma bay right in ORs.
That just doesn't work. So we need to have a dedicated cardiac. For the STEMIs, you know, we have limited time. They have to be in the cath lab within 12 minutes, you know.
Just the other day when we were putting the puzzle pieces on the map, I noticed that I was setting up the department like it currently exists. So really having to stop each other and say, wait a minute, that's how it is today, that let's think bigger, let's think broader, let's think about the future.
I think our CT scanners are closer now than they are in this lab.
Perfect, right?
Well, I don't know how long.
I just think it's been very valuable for the physicians and the other staff that are here to feel like their opinions matter and that we're using their expertise to help design this new project.
The physicians coming to the table made this invaluable for us because the product is better, the product is different. They're the ones who are going to bring patients to us. The rest of us have to orchestrate the patient's care. And without them at the table, we couldn't have done that. And it turned out to be a better place and everyone felt like they were valued. And that's what the patients want to feel. They don't come to a hospital, they come to a place to be cared for by a group of people that they trust. And they don't see the walls, and today taught us that we don't have to see them either.
Now, so I understand your issue that you need grab bars on both sides.
We don't need a big cumbersome walker room. An iPad would be ideal.
So for that one, how do you know that's the right one? I don't. Okay.
Not only an amazing facility, but hopefully a change in the culture of healthcare delivery that will not only affect our local and regional communities, but should, if done properly, will affect generations to come beyond us, that we've changed the culture in which healthcare is delivered. I would also think it could be a model for other facilities within the state and even beyond, as we have shown that a regional facility can truly change, innovate, and educate.